Well, for Philips ultrasound and for me as a clinician, what is new in at ESC, it's looking again at how important the heart failure and the new treatments for aortic stenosis have gained a place in our discussions and in the clinical practice. So in that sense, there are two things that are very important to highlight. First, the transcatheter aortic valve replacement, that it's not a new thing by itself anymore, but has such a short and growing impressive history that we always have to come back to that subject. And what is new about it? It's a treatment that started about a decade ago and started to be approved for patients with prohibitive risk for surgery, then patients with high risk, and recently has been shown its benefit and approved for patients with intermediate risk for surgery. So we are seeing truly an advance of a treatment that, instead of being the conventional surgery, it's performed through an external access, like a transcatheteral access that can be through a femoral access, and from that standpoint to have a much less invasive procedure that allows patients to come back home early on. So in that sense, that's something new, and where imaging also plays an extraordinary role. Plays an extraordinary role in the selection of patients, in also assisting in the guidance of the procedure and evaluating of complications. And that's a topic that I think it's also important to highlight, because as we are seeing this application of treatment to a larger subset of patients, we're concerned about complications. I can't say it's higher, but it's highlighted again because we have to be sure as clinicians that we are providing with an effective solution. So using imaging modalities, Philips has been using transesophageal echocardiography 3D for almost a decade. So clinicians have long experience with that, and that has allowed to increase the selection of patients in an accurate way, and also to assist the procedure and to evaluate the outcomes. I cannot say that imaging is being overused. Imaging allows us to see further, to see as clinicians, after doing a proper physical exam, at this moment, having access to image as an echocardiogram, which is a non-invasive feature that we can do with the transthoracic probe, provides us with such an amount of information that the level that allows us to treat our patient better is tremendous. When we consider the word overuse, we should be aware that we would have to analyze imaging by image modality and scenario by scenario, and we cannot say that won't be overused in some contexts. But when seen overall and recognizing its value, it's extraordinary when having a patient that comes with complaints that look to be heart failure, and that's a very important topic to discuss. When having an ultrasound exam, which is an echocardiogram, we can assess in an accurate way the measurement of ejection fraction, and Philips has a new application for that, which allows the clinician with a push of a button to have an accurate measurement using 3D techniques. Having that, it allows us to make decision-making process in terms of what is the therapy that we should apply to this patient. And only having that information, we'll be able to improve patients' outcomes. Well, what we can say that's in cardiac imaging that's absolutely identifiable at this moment is the requirement for accuracy. So image quality is crucial, but on the top of the image quality, as clinicians, we want to be accurate and confident in what we have there. Alongside with these lines, there's a role for the multiple imaging modalities and how we can have access to the information of fusion of modalities. For instance, if we have the information of echocardiography with fluoroscopy, we can assist a procedure having the two imaging modalities providing the best information during the procedure to itself. So that's one of the trends that it's important to highlight. So again, quality, accuracy, and the use of several imaging modalities, or at least two imaging modalities, to complement our information. Well, that's definitely a great question. As a clinician, I've been using Philips ultrasound equipment for more than 10 years. And what I could see from my activity as a clinician and as I foresee for the future is that Philips has been providing us with the top level equipment to understand valvular heart disease using transophageal echo. So it is the company that has the largest experience in the market, and it was tremendously useful for me as a clinician to have that tool available to help my patients. And now we also add to that, in terms of the transthoracic echocardiography, the capability of having one single probe, having 3D echo finally available for the workflow and for the daily routine. And having the 3D for the left ventricle ejection fraction measurement is the most accurate tool that we can use when applying echocardiography to understand left ventricle ejection fraction. So those two main reasons I would highlight as the main goals to go for Philips.